Okay, good morning, everybody. We're going to go ahead and get started. Today is Friday, October 16th, and it is 8 a.m. My name is Sandy Andre, and I am joined this morning by my colleagues Patrick Edsenga and Marcus Campbell. We are attorneys in Miller Johnson's Labor and Employment section, and for those who have been with us all along, you know that Miller Johnson has developed a COVID-19 response team, and we've been monitoring all of the COVID-19 related developments very closely, and these webinars are part of that service. And so with the newest developments just in the last few days, we're here this morning to discuss the MDHHS emergency order that was issued last Friday, October 9th, and we are going to discuss the MIOSHA emergency rule that was issued just earlier this week. I am going to talk a little bit about the emergency order and a little bit of quick MIOSHA refresher, and then I'm going to hand it over to Patrick and Marcus to talk more specifically about the MIOSHA emergency rule. And at the end, we will field a couple of Q&As. Some we have already gotten in advance, and so we've queued those up to walk through that analysis with you. But each of the three of us will be monitoring the Q&A button on your screen, and we'll be monitoring those, looking for themes in some of our questions. But before we get started today, I just wanted to pause and talk a little bit about what our presentation this morning is not intended to be about. So we fully understand that there are several questions related to the MDHHS director's powers under the statute and the MIOSHA director's powers under the MIOSHA Act to issue emergency rules and all of those pieces. And so we fully expect that those issues will be litigated or will be challenged. And so we're not going to get into that piece of it this morning. Today, our job really is just to talk to you all about what are in those orders, what's in the MDHHS order and what is in the emergency rule as it is written, and talk to you a little bit about what that means for you. So that you can stay compliant. And certainly, as we did with Governor Whitmer's executive orders, we are following any of those pieces of litigation very closely, and as they impact the effectiveness of any of these orders or any of these rules, you can be sure that you will hear back from us in pretty short order talking to you about what that means for you in your workplace. So let's go ahead and get started first by talking a little bit about the MDHHS emergency order. Next slide, please. So as I mentioned, this order was issued last Friday, October 9th. You may remember last week, Miller Johnson had a webinar with some of our colleagues talking about the impact of the October 2nd Michigan Supreme Court ruling, and we were talking about a different MDHHS emergency order. So just last Friday, an updated emergency order was issued, and that order is set to go through October 30th. And remember that under the statute, the director of MDHHS has the ability to issue emergency orders and that he can prohibit the gathering of people for any purpose, and he can establish procedures to be followed during an epidemic to ensure continuation of essential public health services and enforcement of health laws. And so as we look through this emergency order, right, you'll see, if you're wondering, okay, well, why did this executive order not get enveloped in the MDHHS order, but this one did, or pieces of this one did? And the reason is, right, the director can only put stuff in his order that falls under his authority under the statute. And so you'll see that this emergency order generally deals with gatherings, capacity restrictions, and face coverings. So we'll talk a little bit about that. Next slide, please. And so as you look at the MDHHS order, as I mentioned, exactly that. There are a couple of pretty broad categories that generally limit attendance limitations at specific gatherings, capacity restrictions for those gatherings, protection of workers, face covering at gatherings, and then a couple of specific requirements for food service establishment, organized sports, and some requirements for contact tracing. And so as we look at this October 9th order and compared that to its predecessors, we see a couple, we're labor and employment attorneys, so the piece that stuck out to us immediately was this protection of workers section. So of course you remember Executive Order 184 had a number. It was the Safeguards to Protect Michigan Workers from COVID-19 order, and it had a number of requirements for all employers and then several industry-specific requirements. And so we were interested to see what was particularly in that section as it related to workers. And so that's the piece that I want to spend the most time on today as it relates to our topic and our audience. Next slide, please. So let's specifically go through that piece. That protection of workers piece generally talks about that gatherings of employees in the workplace are prohibited under certain circumstances. The first is talking about remote work, and generally includes an exclusion, except in Region 6, generally, employers are not permitted to have gatherings in the workplace except where necessary, and only to the extent that employees can still maintain 6 feet of distance from one another when that is practicable. And so we're going to talk a lot more about remote work when we talk about the MIOSHA emergency rule, so we'll kind of hold that discussion, but we just want to flag, right, that there are portions of this emergency order and the emergency rule that overlap. They each talk about a certain topic, and so it's important for us to consider both of these documents and attempt to comply with both of them. So again, the MDHHS order, of course, applies to all workplaces in Michigan, and we need to remember that there are also separate MDHHS orders that have additional requirements. So, for example, residential care facilities and congregate care and juvenile justice facilities have very specific requirements under the MDHHS. And for several of you listening, you may be working in an industry where COVID-19 testing is required for your type of organization. So all of those orders, unless they have expired, are still in effect. So as it stands today, this October 9th order, right, focuses again on when workplace gatherings are allowed. And so as I mentioned about remote work, with the way that the language is written, it's not entirely clear whether the order continues to require remote work for all employees outside of Region 6 who do not need to be present in the workplace to perform their job duties. But as I mentioned, we're going to read it together with the new MIOSHA emergency rule in just a little bit. As we turn to the face covering and social distancing requirements, this MDHHS order requires all employees in the workplace to wear face coverings whenever they are within 6 feet of each other and whenever they are in a shared common space. So our advice at this point, right, it is perfectly acceptable for you all to continue to require your employees to wear face coverings even if they're not within 6 feet of each other. If that's the practice that you have had during this entire time and even under Executive Order 184, that's perfectly appropriate. You'll also notice in this emergency order, there's a requirement for daily self-screenings. I'll tag this one too and say that there is also some overlap in the MIOSHA emergency rule, but generally the MDHHS order requires all employees and contractors entering the workplace must complete a questionnaire that covers symptoms of COVID and whether that employee or contractor has a suspected or confirmed exposure to someone with COVID. You'll notice that this order particularly does not speak to temperature checks, but lucky for us, the MIOSHA emergency rule does, and so hold that thought on temperature checks. But the good news here, right, if you've been complying with the daily screening requirement under Executive Order 184, you generally should be in good shape. Hold for the conversation on temperature checks. So we will talk about that in just a little bit. Next slide, please. Oops. Okay, quarantine. The order goes on to talk about protection of workers for required quarantine and isolation. So we, of course, remember that we had Executive Order 184 that kind of talked to us a little bit about a positive test protocol, right? When we had a confirmed or suspected case, we could only let an employee return under certain circumstances. But we also had another Executive Order 172, that provided attendance protections for certain folks. So as of right now, the attendance protections that existed in Executive Order 172 do not show up in this MDHHS order and do not show up in the MIOSHA emergency rule. So as it's written, as we look at the MDHHS order, employees should not be allowed in the workplace if they are subject to a recommendation to quarantine or isolate consistent with CDC guidelines. So if the public health department or their own healthcare provider has recommended a quarantine or isolation for that individual, we should not be letting them in the workplace. Number two, if they've been instructed by a health or public health professional to remain home. And number three, if they are awaiting a COVID test or the result of a COVID test after having symptoms of COVID until, of course, and this looks like a familiar timeline to us, hopefully, 24 hours have passed, the resolution of a fever if they had a fever, 10 days have passed since symptoms first appeared or since their first positive test, because of course we may have some folks who test positive for COVID that are completely asymptomatic the whole time, and so the time frame we should be looking at for those folks is 10 days. And then of course, as other symptoms have improved. So that piece in terms of timeline for return to work should look pretty similar to us. So that is good news. Okay, next slide, please. So for those of you in the audience who have been with us for some time, you may remember that Miller Johnson developed a 3-part MIOSHA COVID webinar series back in July, and those presentations are still up on our website. And some of the materials that are mentioned in those presentations are available in our resource center. So we're not intending to do a deep dive into the inner workings of MIOSHA and every type of standard that could apply to the COVID situation, but we will just quickly give a brief overview so we can all get our bearings, and then Patrick will take us into the depths of the MIOSHA emergency rule. So next slide, please. Let's just quickly talk about what is MIOSHA. And we know, of course, that acronym stands for two things. It stands for the Michigan Occupational Safety and Health Act, and it also stands for the Michigan Occupational Safety and Health Agency. So the agency is the enforcement arm of the statute, right? So Michigan is one of almost 30 states in the country who has a state-specific plan, which federal OSHA allows. So you often hear OSHA, MIOSHA here in Michigan. We follow MIOSHA, those state-specific plans. States are allowed to have them as long as they are at least as stringent as federal OSHA requirements. And for those of you who do a lot of work in this area, you'll notice that requirements are very, very similar across certain areas. But here we are, that here in Michigan, because we have a state plan, we now have an emergency rule related to COVID, and federal OSHA does not have that. So that is one area where we are different, and that's how the two interact. So generally, an employer's obligations under MIOSHA are to provide a safe and healthy work environment free from recognized hazards. We know this. And the Act itself prescribes and regulates certain working conditions, outlines specific duties of employers generally, but also of employees, and outlines a number of standards, those that apply to general industry, those that apply to construction work, and then, of course, the general duty clause. And so we remember that the general duty clause is this overarching obligation for all of us as employers to furnish our employees employment and a place of employment that is free from recognized hazards that are causing or are likely to cause death or serious physical harm to the employee. So this has been the gray area of COVID compliance since day one, right? Since way back in March, and we did our very first webinar, we were talking about the general duty clause and, okay, how do I comply with that in this COVID world without federal OSHA or Michigan OSHA telling me exactly what to do? And so you will maybe remember that there are specific, go ahead and go to the next slide, please. There are specific standards that apply or that could apply to our COVID situation, and those continue to apply, right? So there are specific standards such as the PPE standards, sanitization standards, a respiratory protection standard, hazard communication standards, standards related to employee exposure and medical records, and recording and reporting occupational injury and illnesses. Those are our all existing standards that have applicability to the COVID world that we are living in. And again, if you go back to those July seminars, we get into each of those and how they apply to COVID a little bit more. If you have interest in learning a little bit more about that, we're not going to talk about them here. But as I mentioned, the general duty clause was kind of this gray area that we have been dealing with. Next slide, please. So as we have thought about how to apply the general duty clause to COVID, there has been a timeline of events that are all really important to how we have analyzed this. So you may remember back in June, the Michigan Court of Claims determined that the workplace safeguard executive order was unlawful to the extent that that order included automatic enforcement as a general duty clause violation under MIOSHA. So that piece came out. So it was no longer necessarily a per se general duty clause violation if you missed something in executive order, what eventually became executive order 184, but rather it was intended to kind of be this more totality of the circumstances kind of standpoint, right? And the focus was back on COVID being the hazardous condition that we needed to abate rather than, the water fountain that we had to make sure was turned off was the hazardous condition that we couldn't do. And so on the heels of that, also in June, MIOSHA issued an interim enforcement plan. And so that document was really important because it gave us insight to how the agency itself intended to enforce the general duty clause. And so in that document, they told us that they were going to be looking to federal OSHA's own enforcement memos, Michigan's COVID-19 executive orders, a really important document that you all know about, the OSHA guidance on preparing workplaces for COVID document, and general CDC guidelines. Those are the pieces, those are the data points they were going to use to inform them on how to consider whether an organization was fulfilling its duties under the general duty clause. And I will tell you, in practice, we saw letter inspections starting right around that time where several clients were getting letters from MIOSHA saying, hey, we've received a complaint related to you not doing a daily entry screen or whatever the issue was. What can you tell us about that? What records can you provide us? And generally, employers were able to respond to those letters and provide some documentation, and we didn't see a lot of citation work at that time. However, in August, we saw here in Michigan the first general duty clause citation being issued. And the three of us on this call can speak, right, from firsthand experience that the approach that MIOSHA has taken related to the general duty clause is much more aggressive than the approach that federal OSHA has taken related to the general duty clause as it relates to COVID. Particularly related to MIOSHA's state emphasis programs. So they have kind of launched programs that have a special focus on restaurant, bar, and service industry workplaces, as well as hospitals. So at the federal level, for example, there have been 2 citations for violation of the general duty clause, and both of those have been in food processing type facilities, and both of those were related to significant virus outbreaks among workers, and in some cases have resulted in death of those workers. But that is not what we've seen here in Michigan. It hasn't been just associated in places where there have been outbreaks, in fact. And so then the next significant happening here in our timeline was here in October. So this is the space we are in right now, right? The executive orders were invalidated on October 2nd, but an old July 30th MDHHS order remained in effect, and that order was important because it encompassed a previous version of the workplace safeguards order, right? So at that time, at least Executive Order 160 and 161, which is what the orders were at that time, were enveloped in the MDHS order, so that was still on the table. But quickly thereafter, right away on October 5th, MDHHS rescinded the July order and issued a new order that included only restrictions or requirements related to gatherings and masks, and so no workplace safeguards. So if you tuned into one of our webinars last week, you heard our presenters having that discussion and some consternation about that, and the clients asking us, well, what should we do? Should we just stop doing everything? And we kind of just said, hold tight. We think there's a lot of movement in this area, so pause, but stay with us. And so as if we were all looking into a crystal ball, that's exactly what's happened in the last week and a half. So MDHHS has issued a new order. Just Monday, the Michigan Supreme Court confirmed that its October 2nd decision related to the executive orders took immediate effect. So we know that 184 for sure is no longer on the table. And then Wednesday, MIOSHA issued our emergency rule. So next slide, please. And so after all of that history, we just want to say that if you feel like this, it is okay, right? What am I looking at and how did I get here? Probably the three of us on this call ask ourselves this. We probably won't admit how many times per day we ask ourselves this to ourselves or out loud to a colleague. But we understand that it's quickly moving and different rules for different days. And if you kind of remember in the beginning of this pandemic, there was a lot happening on a daily basis and a lot of information getting pushed out. And then we slowed that down a little bit in the middle. We had kind of a regular rhythm. But as things have happened here this month, we're starting to get back to this kind of quickly moving type of cadence. And so we just wanted to give you a little bit of background about how we got here and what it means. And now Patrick is going to take us into the details related to the emergency rule.
Good morning, everyone. I'm Patrick Edsenga, and I get to, as Sandy mentioned, talk to you about the very recently issued MIOSHA emergency rule. So what is the MIOSHA emergency rule? I guess the first question is, can they do this? Can they just push out a rule and it take effect essentially immediately? And the answer is yes, although that potentially will be litigated as well. But they do have the authority to do this by statute. And essentially, why they get to do this is they are saying there's an emergency that does not permit them to go through their usual rulemaking process, which would involve publishing proposed rules, and then under the Administrative Procedures Act, giving the public time to comment on that, taking those comments into consideration, and then issuing final rules. And MIOSHA's position is that they don't have the ability to do that right now, to follow that process, because we are in an emergency and employees will not be protected if they follow that process because there will be a lag. So this order was issued this Wednesday. It essentially takes effect right away, and it is effective for 6 months. And then depending on what happens, it can be extended for an additional 6 months. So probably a lot of people groaned when this happened. To a certain extent, it's bad news. To a certain extent, it's good news. An emergency rule without the ability to comment is not ideal. The comment process can be very helpful to an agency and can certainly make the public employers feel heard here. But at the same time, now we have specific rules from MIOSHA, which we're not in the vague land of the general duty clause and when am I complying with the general duty clause versus not. Now we have rules laid out by MIOSHA that employers need to follow, and so that is good news. The other good news is that much of this emergency rule looks an awful lot like Executive Order 184, and it's less restrictive in certain places. The bad news is two parts. One, it looks a lot like emergency rule or Executive Order 184, and it's more restrictive in certain places, and we'll talk about that. And then I guess, you know, the other bad part here is it's vague. It's an emergency rule. There's certain areas we're going to talk about in just a minute where you can interpret things multiple ways, and that's what happens when you issue an emergency rule in a hurry. It's not as tightly drafted as it might be. The public can't comment on these ambiguities that they see, so it goes out, and now we're left to try and interpret it, and in certain spots, it's definitely ambiguous, and we're going to just try our best to figure out what they mean, but we will also point out to you where multiple interpretations are available and defensible. So this emergency rule is broken down into sections. As I mentioned, there are 11 rules. I would say, you know, 8 or 9 of them apply to all employers, and then there are certain industry-specific requirements, just as there were in Executive Order 184. So I'm going to talk about the rules that apply to all employers. Mark will then walk you through the industry-specific requirements, and then we'll answer your questions. So the first thing that you need to understand with this is who does this apply to? And it essentially applies to all of you. It applies to any employer in Michigan with 1 or more employees, with very, very, very limited exceptions, essentially domestic work and working in a mine. Beyond that, it's going to apply to you. So these rules are out there and need to be followed by all of you while they're in effect. The second section of this rule contains some definitions, and these definitions in some ways are going to sound very familiar, in other ways they're slightly different. So the definitions that MIOSHA provides, they define what a close contact is. It's the same definition as you've all been applying. It's being within 6 feet of somebody with COVID for 15 minutes, beginning at least 2 days, or beginning 2 days before their positive test, if they have no symptoms, or before their symptoms showed up. So that's what a close contact is. That's the way CDC's been defining it. That's the way MDHHS is defining it. That's the way the governor's been defining it. So that's not new. They also define COVID-19 and include a discussion of some symptoms. So they say COVID-19 is characterized by symptoms including fever, cough, fatigue, and shortness of breath. They don't say those are the only symptoms. Certainly you all know that there are other symptoms, among others, you know, new loss of taste and smell, body aches, chills, things like that. So it's not an exhaustive list. They just give you a few of the symptoms. And then they also define what a suspected case of COVID is. And a suspected case of COVID is a person who has symptoms of COVID but hasn't yet been confirmed as positive or gone through diagnostic testing. And it also means a person in close contact with somebody who has been confirmed to have COVID. So those are the definitions. Once you get through the definitions, what MIOSHA is asking all employers to do is to essentially make an exposure determination for each of their sort of job tasks, the tasks that employees are doing. And we'll call that a hazard assessment. This is something probably familiar to all of you because they pulled this from federal OSHA's guidance on employers, guidance to employers in the COVID-19 pandemic. And so there's 4 categories. You have low risk, medium risk, high risk, and very high risk. And it all depends on the likelihood of exposure to COVID in a particular job duty, job classification. So most of you are going to have employees and job duties that fall in the low risk or the medium risk category. High risk, very high risk are usually almost always in the healthcare setting. And very high risk is when you're doing aerosol generating procedures in the healthcare setting, in a mortuary, things like that. So low risk means the job tasks are those that don't require contact with people known or suspected of being infected with COVID, nor frequent close contact with the general public. And what MIOSHA says in the rule is workers in this category have minimal contact with the public and other coworkers. So that's low risk. Medium risk, and this is a little more wishy-washy, is job tasks being performed that require frequent or close contact with people who may be infected with COVID, but who are not yet known or suspected of being COVID patients. And they say in areas with ongoing community transmission, which is unfortunately essentially the entire country at this point, that is going to be workers who have contact with the general public. And I guess there's potentially an argument that it involves, close contact with a lot of coworkers throughout the day as well. So if you're working in very close quarters with a lot of other coworkers, it's at least possible they could say that's medium risk. But the argument on the other side could be, well, we have all these measures in place to screen out people who might have COVID, so that's not the case. But most of you are going to fall in the low and medium risk categories. So after you make your hazard assessment, you're going to be required to make a preparedness and response plan. And our suspicion is all of you already have this because this was required by the executive order. And the MIOSHA is relying on the same sort of CDC and OSHA guidance on preparing these things that the governor was. So if you have one of these and you have it in place, then you need to do nothing really, except update it if you change any of your prevention and control measures. So that's the good news. The other requirement here is exactly what the governor required before, which is you need to make this readily available to your employees. And you need to do that, via a website or your internal network or hard copy. So again, you're probably all doing this. This is not new, but you need to continue to do this under MIOSHA's emergency rule. So they also talk about what needs to be in the preparedness and response plan. I'll just go back to that. They talk about engineering controls, administrative controls, basic infection prevention measures, PPE, health surveillance, and training. The emergency rule then walks you through what are the basic infection prevention measures, PPE, health surveillance, and training requirements. So you don't really need to worry about that too much. Engineering controls are things like physical barriers, maybe the air exchange in your building. But if you have low-risk employees, at least what OSHA, federal OSHA says is you don't need to put in any engineering controls in place. If you're at medium risk, that's things like, a plexiglass barrier between the public and your employee. So most of you are not going to be worrying about engineering controls. If you're in that high risk and very high risk category, you are, and you're probably already doing things with your air exchange and isolating confirmed and suspected COVID cases and things of that nature. Administrative controls are a little more vague. Again, if you're low risk, there's not much you need to do other than just keep up to date on the latest guidance and then communicate that to employees and have a plan to do that. If you're in the medium risk category, that's stuff like, trying to minimize face-to-face contact, limiting public access to the workplace to the extent it's practical and things like that. So not a ton to worry about there, and that's probably already laid out in your response plan. And then you're going to go ahead and implement the measures that MIOSHA is telling you for the other areas, and we'll walk through those right now. So the basic infection prevention measures that MIOSHA is requiring are going to sound very familiar, again, because they're pretty much taken from the executive order, CDC guidance, things like that. So we're going to promote frequent hand washing and give our employees the ability to wash their hands. If you don't have soap and water available, you're going to have hand sanitizer or alcohol hand wipes available, and it needs to be at least 60% alcohol. You're going to require sick employees to not report to work or work in an isolated location. Right now, our recommendation is if somebody's sick, they shouldn't be coming to work. If they can work remotely and their health permit's great, but I don't think we want anybody who's sick in the workplace on the chance that they do have COVID or, the flu or something like that and could infect other people. Beyond that, you're going to prohibit sharing of equipment and, phones, desks, offices, things of that nature, if at all possible. You're going to increase your facility cleaning to limit exposure, something I'm sure you're all doing already. And then you're going to establish a cleaning protocol when you have a positive or suspected case of COVID. Again, My suspicion is you all have that in place. That may require you to close down your whole facility. That may require you to just shut down a part of it. It really depends on how your operation works and whether employees are throughout the whole facility or are working in a confined area. So it really depends, but you're going to want to have a protocol in place if and when somebody either has COVID or is suspected of having COVID. You're going to use EPA-approved disinfectants when you are cleaning surfaces, and you can go online. There's a ton of stuff from the EPA. I just checked again this morning on what are those approved disinfectants that you're going to want to be using, and there's plenty of them. And then you're going to follow the instructions from the manufacturer on cleaning and disinfecting. And those are all, basic, generally common sense infection prevention measures. Now, they slip in as an infection prevention measure, something that you might not necessarily think about as an infection prevention measure, which is remote work. And this is the one that's going to cause a little more discussion than the others. So what this rule says, and I'll just read it to you, is the employer shall create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So we underline feasibly because what does that mean? It's an adverb. It presumably can have different meanings to different people. And how does that differ from what the governor previously said in her executive order about remote work? So feasibly, I looked it up last night, means capable of being done or carried out according to Merriam-Webster Dictionary. So I think if you look at what Executive Order 176 said, which is any work capable of being performed remotely must be performed remotely except in Region 6 or 8. So I think when they say feasibly, they are trying to give you the exact same requirement definition that the governor did, but using different words, probably because they don't want to look like they are just verbatim copying everything the governor did. But it essentially means capable of being done. So if work is capable of being done remotely, it must be done remotely under the emergency rule. Now, again, there's a little bit of wiggle room there just because when is it capable of being done remotely? And does that mean being done well or just being done? It's a little bit ambiguous, but that is probably the intention here. And if you have people working from home and it's going fine, we would recommend you continue doing that. You'll also notice in the MIOSHA emergency rules, unlike the governor's executive order and unlike the MDHHS order, there's no Region 6 carve out. There is no carve out whatsoever. It just says any employer who's covered by this needs to have a policy prohibiting in-person work if it can be feasibly completed remotely. So what do you do if you're in Region 6? That's a fantastic question. It's very much going to depend on if we get any clarification in the future because it's a direct conflict between the MDHHS order, which is in effect, and these emergency rules, which are in effect. There's, like I said, there's no good answer here. You could probably defend either position, but very clearly, MIOSHA's emergency rules don't contain that carve out. So it's at least possible if MIOSHA showed up that you had people working physically in the office or whatever the space is that could be doing the work remotely, they might find that to be a violation of these emergency rules. After that, you need to look at what are the health surveillance measures that the emergency rule put in place. And those, again, are going to seem pretty familiar, although we're going to talk in just a second about one new thing that applies to all employers. So everyone needs to continue to conduct daily entry self-screening protocols for all employers and contractors that are entering the workplace. And that includes, at a minimum, a questionnaire covering symptoms and suspected or confirmed exposure to people who might have COVID-19. That is something that everybody's had to do before under the governor's executive order. So just continue whatever process you have in place for that, including keeping records, which we'll discuss later. But what's new under the emergency rules is the requirement potentially that you need to conduct temperature screening. So in addition to the questionnaire covering symptoms and suspected or confirmed exposure, the MIOSHA emergency rule says that employers need to, if possible, conduct temperature screening. What does that mean? There's a couple things that are ambiguous here. So first, this rule talks about a daily entry self-screening protocol. And then it says, together with, if possible, a temperature screening. So it's potentially possible to look at this and say, well, we can have employees do that on their own. I don't think that's what MIOSHA meant. I think what MIOSHA means is if you can take employees' temperatures when they're coming into work, if it's possible, do that. But if you don't think it's possible or you don't think it's practical for you to do that, that is an interpretation to take. The way you would probably do that is say all employees need to take their temperature within an hour within 1 hour before they come to work. And then they can report, it's below a certain level. And if they say, yes, I took my temperature within an hour, and yes, it's below 100.4, then you let them in. If they answer no to either of those questions, then you don't let them in. If MIOSHA showed up and you showed them that information, I suspect they would tell you you need to take employees' temperatures. However, I don't know that you would necessarily get cited because you do have something in place for temperature screenings. But it seems more likely that they mean you should be doing the temperature screenings. So again, ambiguity, not known. Both positions are defensible. But if you want to be certain that you're complying with the emergency rule, take the temperatures, or if possible, means, I think it means you better have a good reason that you can't do it, whether it's you can't get thermometers, people are spread out all over the place in multiple locations or in multiple entry points, and it's not realistic to get everybody to come through the same entry point, or having everybody come through the same entry point is going to create its own sort of risk. Those are the types of things you might say why it's not possible. So after the daily entry screening protocols, the other health surveillance measures are pretty common sense and are things that you're doing here. So we're going to direct employees to promptly report any signs or symptoms of COVID. We're going to physically isolate anyone with known or suspected cases of COVID. We're going to do that as soon as possible, by sending them home or keeping them away from the workplace or getting them alone working at a remote location if their health permits. You also are going to need to create a positive test protocol, which is something that was required before. And that's for an employee, a visitor, or a customer with a known case. And that protocol includes things that the governor also required. So you need to immediately notify the public health department if you have an employee, visitor, or customer with a known case of COVID. Notice it's not suspected, it's known. But still, if you have known case of COVID in the workplace, you need to immediately notify the health department. And within 24 hours, you need to notify any coworkers, contractors, or suppliers who may have come into contact with that person. So it's not close contact, it's contact. So it's broader, and it can be difficult to figure that out in certain work settings. So maybe you're sending a letter out to all your employees, but the idea is to try and identify who came into contact with that person and to notify them. And then obviously anybody in close contact with them, which is within 6 feet for 15 minutes or more, you're going to tell them they were in close contact. You're going to tell them that they need to quarantine themselves for 14 days. So after the infection prevention measures, the rule also lays out some workplace controls that need to be in place. Again, you've seen these before. You're doing these, I'm sure, but part of your COVID preparedness plan, you need to designate worksite COVID safety coordinator. This was something the governor required. You can designate more than one, but somebody who is designated as a safety coordinator needs to be on site whenever work's being performed. And it doesn't need to be a supervisor per se. You can designate an employee to do this. They just need to be familiar with all the prevention measures and controls that you have in place to prevent the spread of COVID in the workplace. You need to put posters up, and the emergency rule requires 3 different posters. And one is staying away from the workplace when you're sick, one is cough and sneeze etiquette, and the third is proper hand hygiene practices. CDC has all kinds of posters available on its website. I'm sure you've all looked at them before, but you certainly will be able to find each of these posters and probably a poster that contains 2 or 3 of these things. You need to make sure that you have a rule in place that you're maintaining 6 feet of distance between employees to the maximum extent possible. And then you need to figure out ways to try and reduce congestion in the workplace, including using ground marking signs and physical barriers when it's appropriate to do so. You also need to, there's requirements on face coverings, just as there were under the governor's executive order. You need to require and provide that employees wear non-medical grade face coverings when they're in shared spaces, when they can't maintain 6 feet of distance. You're certainly free to require them to wear face coverings in other situations or when they're in the workplace, but those are the situations when it's required. When you're in a shared space, which is, you know, a hallway, a bathroom, a meeting, things of that nature, they need to be wearing face coverings. And then whenever they're working in a way where they can't maintain consistent 6 feet of distance from other employees. And then just as the governor's executive order, MIOSHA says that you should consider, but it doesn't require, you should consider face shields when employees cannot consistently maintain 3 feet of separation. This one always confuses me a little bit. I don't really know what consider it means. I guess if you think about it and decide it's not something you want to do, that's okay. I would note that, you know, I've had to respond to MIOSHA on this particular point. CDC does not recommend face shields because their position is not clear that they prevent spread. So a little bit of conflict between MIOSHA and CDC there. The order or the rule also talks about PPE requirements for all employees, and this really boils down to your exposure risk. And, you know, for low risk jobs, there's no additional PPE recommended or required. It's just face masks. For medium risk jobs, what the OSHA guidance says, the federal OSHA guidance says, these employees may need some combination of face mask, face shield, goggles, gloves, and a gown. I think in most situations where they're interfacing with the public, you know, a face mask is going to be good, maybe some gloves. But you really need to be focused on the exposure risk and their contact with others in deciding what PPE is appropriate. High risk and very high risk, obviously the PPE requirements go up a lot. At high risk level, you're going to be talking about N95 respirators and things like that. If you're providing PPE, you want to follow CDC and OSHA guidance. Make sure it's properly fitted, used in the right way. You regularly inspect, maintain, and replace it. You regularly clean it in a proper fashion to avoid contamination, and you train your employees on it. That's what I was talking about at the higher risk. So these are the things you're going to want to consider if that's you: N95s, goggles, face shields, and a gown. You all already know this if you're doing that, and you're certainly all doing this if it's at all possible to do it, given supplies. So the other things that are required is training for all employees. This is the training the governor required. You need to provide it in the primary language common in your employee population, and it needs to cover workplace infection control practices, proper use of PPE, steps the employee must take to notify the business of any symptoms of COVID or suspected or confirmed diagnosis, and how to report unsafe working conditions. Exactly what the governor required before. I'm guessing you've all done this training for your employees. If you haven't, we have a short 12, 13-minute training video available. You can email us and ask us about it. But like I said, since this has been required for essentially, 3, 4, 5 months, my guess is you've all done that. And then you want to update your training if you update your preparedness and response plan. And then one point on how to report unsafe working conditions. I don't think that necessarily needs to be interpreted as telling employees, this is how you contact MIOSHA. I think it can be, this is who you talk to internally to report unsafe working conditions, be it HR, your supervisor, or someone else. And then lastly, there are record-keeping requirements. So under the emergency rule, employers need to maintain records of the training they did for employees, of their screening protocols, and then any required notifications, whether it's to employees in close contact or contact the health department if you're corresponding with them. You want to hold on to that stuff for 1 year. And with that, I'm going to kick it over to Mark to talk about the industry-specific requirements in the emergency rule.
All right. Thank you, Patrick. I appreciate that. I hope everybody's hanging in there. I'm going to address some of the industry-specific requirements, and then after that, we're going to go through some questions and give you some answers on those. With respect to the industry-specific requirements, these rules have specific industry-specific sections on there. Now, those rules apply to those specific industries, but it's important that you know that the other rules that apply to employers in general, those will also apply to you. But these are sort of additional specific rules that apply to your industry. So make sure that you're applying with both the general employer rules as well as the industry specific rules if they apply to you. So let's talk about the construction industry. Under the emergency rules, in the construction industry, you have to have dedicated entry points for daily screening. The reason that they want you to do that is so that individuals do not bypass screening. And I know sometimes on construction sites, it is hard to do that. There are multiple entry points. If possible, limit your entry points so that everyone can go through your screening process. If that is not possible, the rule requires you to find some other type of indicator to show that the employee has been screened in some way. Perhaps a sticker is what they recommend, like the I voted sticker, have an I've been screened sticker. The rules also require the construction industry to identify choke points, which are areas where people naturally are forced to be close to each other, as well as high-risk areas, which are areas where individuals, multiple individuals, frequently go, places like the tool trailer. And you need to make sure that you can ensure social distancing in those areas. If you could put barriers, maybe some sort of physical barrier, if you could at least at minimum put up signs letting people in those high-risk areas know that they need to maintain social distancing, then you'll be in compliance with the rules. You also have to create protocols for minimizing personal contact upon the delivery of materials at the work site. So you'll have to come up with some sort of rules that limit the number of individuals, perhaps maybe have designated individuals handle the material deliveries rather than a number of individuals. You just want to try to limit the number of people that are in contact with your vendors that are delivering materials to your work site. Can we get the next slide, please? Manufacturing, a similar type of rules required. Create dedicated entry points for daily screening and ensure that physical barriers are in place to prevent anyone from bypassing the screening. So you could have mandatory entry points and require employees to enter through specific entrances and exit through specific exits, and perhaps have a policy that says you must do that. If you do not do that, if we catch you entering through a different entrance, you will be subject to some sort of discipline. Those are the types of things that MIOSHA is going to want to see when they come into your workplace. You also have to create protocols for minimizing personal contact upon delivery of materials, similar to construction. Let's have dedicated individuals, the fewest number of individuals possible, handling your materials deliveries from your vendors. Next, we'll talk about retail, industry, libraries, and museums. You need to create communications for customers to explain and inform them of the changes in your practices and explain the precautions you have taken. Now, that can be signs, that can be a pamphlet. You can put that on your website. Just so that your customers know, here are the reasons why we have made these changes. Of course, unless you've been in a bubble for the last 10 months, they know why. But you are required to do that under the rules. You also have to require all of your customers to wear a face covering. You should post signs at all entrances and exits that inform customers that they need to wear a face covering and that they should not enter the building if they are sick. The rules require you to design spaces and activities in a manner that encourage social distancing. So arrange your space in a way that will allow your customers to be able to socially distance. You might have to rearrange your walkways, rearrange your displays, so that you give customers enough space so that they can still enter your facility and still socially distance from one another. You need to install physical barriers at the checkout or other service points. You've seen that that has become very common now. When somebody's checking out, have some sort of plexiglass or other physical barrier there. At the service counter, have a plexiglass or other physical barrier there so that there is at least something between the customer and your employee to provide some sort of protection for your employee. You also need to establish enhanced cleaning and sanitizing practices for your high-touch areas. And there are capacity restrictions based on the MDHHS order of 50% of the amount that the local fire marshal would allow to enter your building. So you have to ensure that you do not exceed that 50% capacity restriction. Let's talk about restaurants and bars. They require 6 feet of separation between parties. You have to require all of your guests to wear a face covering except when they are seated at their table or at the bar top. You have to prohibit access to common areas where people can congregate, such as, let's say, drinking fountains or other areas. You need to create communications for customers to inform them of the changes in your practices and explain the precautions. Again, this is something like a sign on the door to let customers know while you're taking these practices. Put something on your website just to inform customers why these changes are occurring. You also need to post signs which says wear a face covering until seated at their table and do not enter the establishment if they're sick. These are things that were very common under the previous executive orders, and they continue to be required under these new emergency rules. As far as the healthcare industry, you need to post signs instructing patients that they need to wear a face covering. You need to limit the waiting area occupancy to the number of individuals that can be present while still maintaining a 6-foot social distance from one another. So basically, you go through your waiting room and you see how many people can I fit in here and keep everyone still 6 feet apart. And that's the number of people that you're allowed to have in your waiting room. Other individuals will have to wait outside or in their cars. You have to mark or arrange your waiting rooms in order to enable social distancing. So that might mean if you have 50 chairs in your waiting room, you may have to remove some of those chairs. You may have to put a sign on some of those chairs that say, please do not sit here. You have to take some sort of action to make sure that when your patients come into your waiting room, that they sit down or wait 6 feet apart from one another. You also have to conduct a screening protocol for all patients, which includes temperature checks as well as questions about the COVID symptoms. You are required to place hand sanitizer and face coverings at all patient entrances, and you are to require patients to wear face coverings at all times while in the facility. There are some very limited exceptions for identification purposes if it needs to be removed. If a patient has a medical condition and they cannot medically tolerate a face covering, that is acceptable, but by and far for the majority of your patients, they're required to wear a face covering. You need to install physical barriers at the sign-in area, the temperature screening area, at other service points. Just like retail stores and whatnot, we have to do the same thing in the healthcare facility. Anywhere where the patient is going to come in contact with our employees and provide information to them, we need some sort of physical barrier there to protect the employee. Let's talk about in-home services. Now, with in-home services, we're talking about, let's say, cleaning companies, repair technicians, plumbers, anyone that comes into a customer's home to provide some sort of service. Those individuals need to maintain accurate appointment records, including the date and time of service, the name of the customer, and the contact information. This is because the MDHHS order requires in-home services companies to keep this information for contact tracing purposes. So there is a little more of a record-keeping burden with respect to in-home services. So make sure that you are keeping that information of the appointments and that as well as contact information on the customers. Because if you receive a call from the Kent County Health Department saying so-and-so tested positive, you're going to need to make sure that you assist them so that they can contact trace to all the customers that perhaps your positive employee had visited that day when they were working. So make sure you maintain that the record-keeping information. Prior to entering the home, the service technician or employee has to inquire with the customer whether anyone in the household has been diagnosed with COVID-19 or is experiencing symptoms or has had close contact. If the answer is yes, then the employee should leave. And we should make sure that the employees know that they should leave. Let's talk with personal care services. What we're talking about with personal care services, generally beauty salons, barber shops, tanning salons, tattoo parlors, those types of employers. They're required to post signs that indicate that their clients must wear a face covering and that they should not enter if they are sick. They also are to restrict entry to the customers and any caregiver that the customer brings with him or her or the customer's minor children. What this is getting at is that they want, if at all possible, to have the customer only show up. Sometimes the customer can't. They have a caregiver. That is acceptable if the caregiver goes. Customer has children. It's acceptable to bring children to the appointment. But the customer shouldn't show up with a group of 4 or 5 of their friends while they're having the services performed. You have to limit it, if possible, to the customer only. We should limit the waiting area occupancy so that everybody can maintain a 6-foot social distance. So that may require rearranging the waiting rooms, perhaps putting signs on chairs saying, please do not sit here in order to maintain social distance, something like that, so that everyone in your waiting room is able to maintain a safe 6-foot social distance. There should be no magazines or any other materials in the waiting room. Those must be discarded, and any shared items must be disinfected. And with personal care services, you have the same contact tracing requirements as far as record keeping. You need to keep records of all the individuals that have appointments. You should have contact information for those individuals, and you should save that information so that if you have an employee that tests positive, that the health department can do its job and conduct contact tracing with any customers that employee may have come in contact with. All right. Now, in situations with personal care services where a customer may have to remove a face mask, let's say for a facial or some type of service like that, you will have to require your employee to wear a face covering or some sort of face shield to protect themselves when the customer has to remove a face mask. All right, let's talk about places of public accommodation. Now with this, we're talking about movie theaters, sporting venues, places of amusement, bowling alleys, any place where you go where people congregate in order to have fun. Specific requirements for public accommodations are the same signs have to be posted. You must wear a face covering. You're not permitted to enter if you're sick. All patrons are required to wear a face covering. We must establish crowd limiting measures, and they have to have safe exit procedures. And with respect to public accommodations, contact tracing record keeping is also required. This is quite a substantial burden, but at minimum, what you should obtain is your guests' names and your phone number and be able to know the date that they were at your facility. Again, this is all for contact tracing purposes so that if you were to receive a call from the Kent County Health Department about a positive employee, that you can give that information to the health department so it can do its job. Now let's talk about sports and exercise facilities. Similar type of requirement. They have to wear, customers must wear face coverings, not permitted to enter if they are sick. We need signs indicating such. We have to have regular equipment cleaning. The capacity restrictions from the MDHHS order is 25% of what the local fire marshal has said maximum capacity is. And we must maintain a 6-foot distance between each workout station. And again, similar as with some of the other industries, the information required for contact tracing must be maintained. So we're talking about the date they entered the facility, the name, and some sort of phone number. Now, meat and poultry processing facilities, they have to have a dedicated entry point for screening. That's just so we must control the ingress and egress to the facility so that individuals do not bypass the screening. And this is one that both federal OSHA and MIOSHA have been a bit of a stickler on for any type of food processing facilities. They want to make sure that you're screening employees. And they do take this one very seriously. So if this is your industry, you are in meat and poultry processing or any type of food processing job, you want to make sure that you do the screening, have a dedicated entry point, and take that seriously because there's substantial enforcement, especially in the area of food processing. Also, in meat and poultry processing, sometimes face masks get soiled. You have an obligation to make sure that you have additional face masks available for employees should they need one. And the next is casinos. Casinos, you have to have signs indicating that all customers must wear face covering and practice social distancing, proper hand washing, and may not enter if they are sick. You must have designated entry and exit points. You have to require face coverings for all of your guests. The capacity restrictions for casinos is 15% of the maximum capacity. And there's daily entry screening for all guests that visit. Everybody entering the facility of a casino, employees and customers, must have screening for symptoms and temperature checks as well. That's a little bit different than some other areas, but under these rules, they require COVID screening for both the customers and employees, as well as temperature checks for both. Now, with that, I will turn it over to Sandy, and she will discuss the takeaways, and then we'll address a few questions that have been asked.
Sure, thanks, Mark. Okay, let's, if your head is not spinning, good for you. You're ahead of the game here, but let's go ahead and go to the next slide. And we'll talk about some of the big picture things that we want you to keep in mind. We fully recognize that there's a lot here to digest. So we can only, eat this elephant one bite at a time. So the first place to start is it's important to read the MDHHS order and the MIOSHA emergency rule together, right? So because the MDHHS order has information related to, for example, I saw a lot of questions in the queue related to capacity restrictions. You're going to generally find those types of restrictions for your type of organization in the MDHHS order, not in the MIOSHA rule. So if you remember way back when, there was the Safe Start order, and then there was the Safeguards for Workers order. And remember, way back when, we kind of told you, think of the Safe Start order as the order that tells you if you are allowed to be open, and the Safeguards order to say if you are allowed to be open, these are the things you need to do for your employees and customers. And so it's gotten a little bit more blended with MDHHS order and the MIOSHA emergency rule, but that's still kind of a good way to think about it, right? So if I'm allowed to be open, let's go ahead and look at the MDHHS order to tell me if I'm allowed to be open and what those capacity restrictions might be, and those are different, right, for organized sports or some of those little pieces of the rules of the game. And then we turn to the MIOSHA order to kind of fill in the pieces related to what our workplace and customer-facing areas need to look like. So not quite as clear as it was before, and I'm an attorney, and I like those things to be really clear too. So I understand the frustration point, but if you can kind of continue to think about how those two things go together, just like those old two orders used to go together, that'll be a better, better mental place for you to be in. Okay. But as with anything, we certainly expect that there's going to be more to come, and there's going to be more to say on everything we've talked about today. And we also recognize that that's very unsatisfying too. First, we think that maybe, as Patrick and Marcus have pointed out, there are some places between the order and the rule that definitely cover the same space, and in some places maybe seem to contradict each other. For example, the remote work piece and the carve out for Region 6 that exists in the MDHHS order but is silent in the MIOSHA emergency rule. So I would not be at all surprised if we see some effort to clean up some of those areas of ambiguity in some reissue, just like we got used to, right, kind of the rescission and the reissue process with the executive orders. But you can trust that we will be watching those, and we will put information out to you as soon as any of those gaps get filled. The second piece we talked about in the very beginning, right, so just like with the Michigan executive orders, there's litigation related to the Emergency Powers of the Governor Act. We anticipate that there's some litigation that is likely related to the MDHHS order and the MIOSHA emergency rule, right? Whether either of those agencies are working within their statutory authority. But we saw how long that took with the Michigan executive order. So we don't suggest that you don't do any of this and you just wait around for the litigation to play its way through. That would not be a great strategy. But also you can trust that we are watching those things and we'll be updating you about that as well. The next piece that there's a lot of activity right now actually is potential legislation that might fill in some of these gray areas. So in the queue, I saw tons and tons of questions about old Executive Order 36, which became Executive Order 172, which was kind of that attendance protection piece, right, that talked about if I have these symptoms, I'm allowed to be gone this long. If I'm a close contact with someone with these symptoms, I'm allowed to be gone for 14 days, and tons of questions of, oh my gosh, what happened to that? What do we do? And so what I will tell you is there is some movement in this area. There are a number of bills working their way through the legislative process, one related to unemployment, one specifically related to old EO 36-172 on the attendance protection piece, some related to business liability, nursing home admissions, all of those pieces. Those are just some of the bills working their way through. And we've seen news releases that the governor is expected to sign some of those packages. And so we will be keeping a close eye on that for you and letting you know. In the interim, right, remember that as we read the MDHHS order and the MIOSHA rule together, it talks about generally following the CDC guidelines related to cases or suspected cases, right? So I'm a person suspected of having COVID only to the extent that I have symptoms that haven't been confirmed, that have been confirmed, or I've had close contact with a person who has been confirmed through diagnostic testing. So they look at the MIOSHA rule, that's their definition of suspected cases. And so the MIOSHA rule talks to us about when we keep COVID positive individuals or suspected cases of COVID positive out of the workplace. So if your individual does not fall under fall under the definition of suspected cases in the MIOSHA rule, you're not necessarily required to restrict them from entry. But remember, your local public health department may have different guidance on that, right? So just because the MIOSHA rule doesn't require you to restrict entry, your public health department may put that individual under a quarantine or isolation order, and certainly we need to follow those. And so that's my last piece here is remember that the local public and county health orders may be playing center stage here again with respect to what I just talked about in terms of when folks can come back and when they can't, but also related to some of these additional pieces. So I responded to one question in the queue asking about, do we still need to ask the travel question on our daily screening entry or daily entry questionnaire? And nothing in the MDHHS order requires you to do that. Nothing in the MIOSHA rule requires you to do that. However, there are at least 4 counties right now with local public health orders that specifically speak to some daily entry screening requirements, and at least one of those requires you to ask this travel question. Now, if you remember, back in March, we had a lot of local public health orders kind of filling that same gap, but most of those were rescinded as soon as the governor issued her executive order that addressed this daily entry screening requirement. So I can't look into a crystal ball and don't bet on this, right? But it's certainly possible that now that we have the MDHHS order, now that we have the MIOSHA emergency rule, maybe if we have some legislation get signed, that we might see some of those local public health orders get rescinded and go away because the locals feel like the state has filled the gap in some of the things that they were concerned about. But it's important for you to recognize that there's several places, unfortunately, places that we need to be looking to make sure that we're compliant with what applies to us wherever we happen to be located here in Michigan. Next slide, please. Marcus is going to take us through some of the question and answer.
Great, thank you, Sandy. Let's get the first slide with the question on here. This was the biggest question that we received yet over the last couple of days from employers. Do employees have to wear a face covering at work if they can always be 6 feet away from another person while working? And the answer to that is no. They do not need a face covering in that situation if they can always be 6 feet away, unless they are in what is called a shared space. So that would include, well, we don't officially know. A few things we know that are shared spaces are walkways, hallways, bathrooms, in-person meeting rooms, break rooms. So if you have an employee that is sitting let's say, works on a press machine, and there is nobody within 6 feet of that employee ever in their workstation, that employee does not need to wear a mask. But once that employee steps off onto the walkway to walk back towards the break room, a mask must be put on for that employee. A mask is required. So if you absolutely are certain that you can maintain that 6 foot distance, then a mask is not required unless that employee is walking through a shared space. So let's say the employee is the only person in the break room, sitting there. Well, technically that's a shared space, so a mask is required in that place. Even if they're the only one there, that is a shared space. So masks must be required. So the next question is, the executive orders are invalid. Do we still need to allow people to work remotely? And the answer to that is yes, you do. You have to, if the work can feasibly be done remotely. We don't know what feasibly mean. I think that if at all possible. If it can be done remotely, then it must be done remotely. There's an issue with Region 6. I still believe Region 6 does not have to require remote work. There was still a carve-out in the MDHHS order. There is no such carve-out in the emergency rules from MIOSHA. But I believe that Region 6 still does not have to require remote work. But everyone else, if an individual's work can feasibly be performed remotely, then it must be, according to the new MIOSHA emergency rule. Can I get the next slide, please? All right, the question that we have is, we have an employee that tests positive. When can he or she return to work? And that is a very good question. And the answer to that is 10 days after the symptoms first appeared, or if there were no symptoms after the test was administered, and at least 24 hours without a fever, and any other symptoms that the employee had must have been improved. And if you have a totally asymptomatic employee, then it's 10 days after the positive test result. So that's when you can allow your employees to return to work. Next question I have is, my employee had a fever, but did not get tested for COVID. She feels fine the next day. When can she come back to work? And the answer is 10 days after the symptoms first appeared, or if that employee receives a negative COVID test result. If you have an employee that you have any suspicions about any employee and you keep them out of the workplace, if they later return and they have a negative COVID result, they are no longer a suspected case of COVID. Therefore, they don't fall under the rules anymore and they can return to work. Let's get the next question. Can I send an employee home if he or she has COVID-19 symptoms, even if they tell me I'm fine, I don't want to go home, I have not been in contact with anybody with COVID-19, and we receive this question a lot. Perhaps they say, it's just my sinuses acting up. Or, yeah, I wasn't feeling good, I ate some bad food last night, so that's why I was got the fever. And the answer to that question is, yes, you must send that employee home, even if they think they're absolutely fine, even if they believe they had no exposure to anyone with COVID-19, because under the new emergency rules, anyone exhibiting symptoms of COVID is a suspected case of COVID, and we have a legal requirement to remove all suspected cases of COVID from the workplace. Now, if that employee were to get a test and come back 3 days later and say, here I am, I'm negative, that employee can re-enter the workplace because they are no longer a suspected case of COVID. But even if the employee doesn't want to go, they think they're absolutely fine, we have a legal requirement to send them home if they are exhibiting symptoms of COVID. Now, that is the last question. Patrick, Sandy, are there any other questions that you think that would be good to address right now?
We're continuing to get several of the remote work questions, but I think we've answered those to the best of our ability, right? The ambiguities exist and they are there, but remember, it's related to an individual's outside of the Region 6 carve-out discussion. Remember, it's related to that individual's job duties. It's not necessarily related to the type of business or any of those pieces. It's me, Sandy Andre, if I am able to do my job remotely, then Miller Johnson, right, needs to make sure that I'm working remotely. That's how that piece goes. A couple of questions in here about the face covering piece and medical conditions, right? So if you're an employer and you've got an employee asking for an exception to the face covering requirement, you need to run through, right, the ADA interactive process, those pieces. But at the current state of the pandemic, we are in this direct threat type of area. Even the EEOC says so. So we need to, just because someone asks for a face covering accommodation doesn't mean that the accommodation we give them is, yep, come to work without a face covering, right? You would need to talk with your employment counsel and go through that much more specifically. One quick question, remind us where Region 6 is. This is the Traverse City region. And we had a couple of questions related to just regions in general. Do they still matter? Do they still exist? They still matter to the extent that they're encompassed in the MDHHS order, right? So the appendix to that order talks about the regions, and they reference the regions in that order. So they do still matter. They certainly are still on, right, the My Safe Start dashboard in terms of how different regions are reporting or we're evaluating risk. So to that standpoint, they're still in play here. You know, to the extent that we had a Safe Start order that allowed this region to do this and this region to do that, obviously that's gone away, but the MDHHS orders are kind of replacing that. So don't wipe all of that from your memory just yet. I wouldn't recommend that. And one more question. So again, lots of questions about this close contact piece and when folks can return. And so, right, in terms of your employees who are themselves positive for COVID, they can return 10 days from their test and at least 24 out, right? They've been fever-free without medication for 24 hours and symptoms have improved, and they've been released from a local public health isolation or quarantine order. So kind of 4 requirements for your employee who's COVID positive themselves. Related to close contacts, if they are a close contact of a confirmed positive, the MIOSHA and MDHHS order just simply refers us to CDC guidelines for return. And of course, we know that CDC guidelines have different requirements for healthcare providers, as an example. It has different requirements for critical infrastructure employees, as an example, and has different requirements for what I'll just say is all the rest of us, right? So there are some industry or job differentiations with respect to the CDC recommendations, but what I'll just say is, remember, there's legislation happening here at the state level that may fill that gap or answer that question differently. So it's an evolving situation. So those are the sources to look at for now, but you will hear from us if that changes. Oh, and one more thing, and then I'll stop because we're over here and I want everyone to be able to get to their day. A couple questions in here regarding FFCRA. So FFCRA is still here, right? That was at a statute at the federal level. So that is not at all impacted regarding what's happening here with Michigan executive orders. Right now, of course, we know that is set to sunset on December 31st, which is like 10 weeks from now. And so we'll be watching if that changes. The only thing that may have impacted an individual's eligibility for leave under FFCRA, right? We used to have Executive Order 36 and 172 that we believed counted as a state isolation or quarantine order. So anytime anybody hit the requirements of that executive order, they qualified for emergency paid sick leave under that first qualifying reason. So that order is off the table now, and so those employees, they would need to qualify for FFCRA under a different reason, not basing it specifically on Executive Order 36 and 172. But otherwise, FFCRA eligibility, especially for care of a child for school or place of care closure, none of that has changed. That is all still on the table. And those are the general themes that we are seeing. And so with that, we thank you for your time. We remind you that we will be watching these developments and push out information to you as things change. Remind you that we will post this webinar on our website a little bit later by the weekend, as well as the slides, the audio recording as well as the slides. And Miller Johnson's COVID-19 Resource Center is available, as we talked about, a number of tools that we've mentioned on the webinar this morning or in previous webinars. So we will let you get back to your day, and we hope that you all have a great weekend.